Hi, I'm Heather, and this is my husband Sam. I met Sam when I was 30 years old, and 3 years later, we began trying for a baby. I knew my age was a risk, but it had always been my dream to have a family. Success! After 2 years of trying, I finally fell pregnant. Sam and I were over the moon and couldn't be happier. I was 7 weeks along in the pregnancy when I found out and was so excited to go for my first scan at 12 weeks. 12 weeks along and I finally headed to my scan. The doctor sat me down and explained the additional tests it was recommended that I take, regardless to my age. I took 2 separate screening tests. The screening test indicated the likelihood or chance that I carried a baby with Down syndrome. I went back to the doctors as my screening test showed concerning results that my doctor wanted to test further. I had the option of 2 tests, but I went with the chorionic villus sampling test. This diagnostic test involved analysing the fetal chromosomes to identify Down syndrome. Results came in. I found out I was carrying a child with Down syndrome. I was uneducated and overwhelmed, so I began my research. I started to research Down syndrome and I found out it was a type of intellectual disability. Intellectual disability is characterised by below average intellectual functioning that affects the way in which individuals learn. I found out that children with intellectual disabilities have an IQ of below 70 and have impairments in meeting standards expected in at least 2 domains. I also found out about some of the different ways in which intellectual disability affects children. I researched Down syndrome and tried to find out information more specifically to my diagnosis. I found that there were 3 different severities to Down syndrome: translocation, mosaic, and trisomy 21. I had been diagnosed with trisomy 21. I found out that my diagnosis was caused by an uneven separation of chromosome 21. This meant my egg had 3 copies of chromosome 21 instead of 2. As my egg developed, the chromosome was then copied into every cell of the fertilised egg. I learned that chromosomes contain all of your DNA and provide the instructions for how your body will develop before you're born and function as you grow. Typically, babies are born with 46 individual chromosomes formed into 23 identical pairs, whereas my baby had 47 chromosomes, altering their course of development. I wanted to find out about the potential health issues and characteristics that my child may acquire throughout life. There were 4 areas of characteristics that may be affected: physical, social, intellectual, and emotional. The health issues include heart defects, gastrointestinal problems, respiratory problems, vision problems known as strabismus, short-sightedness, far-sightedness, cataracts, nystagmus, blepharitis and astigmatism, and hearing problems such as ear infections and hearing loss. I found out that not all individuals with Down syndrome have the same physical characteristics. The physical characteristics of newborns with Down syndromes includes extra skin on the back of the neck, low muscle tone, and poor reflexes. The physical characteristics of children with Down syndrome includes their facial shape is more oval due to underdevelopment. Their nasal passage may be narrower and congested more easily. Their ears are small and slightly lower on head. The opening of the eyes appears smaller than normal and slanted upwards, and they have low muscle tone and small oral cavity that may cause the tongue to protrude. I researched the social characteristics and found out that infants with Down syndrome enjoy communicating and make good use of nonverbal skills such as babbling and gestures in social situations. It also listed the ways in which you can support the social characteristics of children with Down syndrome. Children with Down syndrome have good social skills and behaviour. These strategies include opportunities to practice social skills and to learn from others by watching. Children with Down syndrome may require assistance to learn about taking turns, sharing, manners, greetings, and recognising feelings in self and others. They respond well to positive feedback and praise. Explicitly teach the difference between appropriate public and private behaviour. They may also display some impulsive behaviours such as temper tantrums, aggressiveness, and disruptive behaviour. As children with Down syndrome can be sensitive, it's important to find ways to minimise behaviour triggers. A common misconception is that all people with Down syndrome are happy and affectionate. People with Down syndrome experience all the same emotions as everyone else. They get happy, sad, embarrassed, frustrated, thoughtful, and fall in and out of love just as we all do. They may, however, find it difficult to express their feelings in words. This can lead to frustration and the expression of feelings through behaviours. Children with Down syndrome can also suffer from general anxiety due to poor self-regulation or if the routine is changed. I also found out that people with Down syndrome are visual and kinesthetic learners. They can speak clearly, but many may need speech and language therapy to achieve this. They struggle to process information from more than one source at a time and require time to process new skills. They can understand a lot more than they can express with words and have a slower rate of learning than peers. They have difficulty retaining information and directions through verbal communication. Their abilities may be underestimated, which can make them feel frustrated. And some people with Down syndrome will find it challenging to develop language skills, and this can be made worse by hearing loss. How will I cope? How long will my child live? Who can help me, and will I get the support I need? What health issues will they have, and what severity will they have? How will they be included in society? Meet Benji, my beautiful 5-year-old son with mild Down syndrome. Benji suffers from mild hearing problems, prone to his ear infections, making it difficult for him to retain information and directions. His hearing loss is due to his ears becoming blocked from their small size. Benji also has smaller than normal eyes and an oval-shaped face. He has good social skills and enjoys socialising and interacting with other children, but may become anxious if his routine is changed or does not understand information. I have discovered that Benji is a visual and kinesthetic learner. Benji has a slower rate of learning compared to his peers and learns best through repetition and with one-on-one or small group instructions. He also has difficulty expressing his feelings, which sometimes causes frustration. I realised that for Benji to make and maintain friendships, I would have to help. I befriended the parents and made a concerted effort to organise plans for the children to socialise together. Come around to Benji being 5 years old, and I started to look at schools to enrol him in for pre-primary. I decided to have a meeting at the same school in which all of his peers were going to. Unfortunately, I was made to feel very unwelcome by the principal during our meeting and was encouraged not to enrol him as they had no other children with disabilities, just a child with diabetes. He was rude to both Benji and I, to which Benji said, "Goodbye, bumhead." He felt my vibes. I decided to keep Benji with his friends despite these comments, as Benji had developed trusting relationships and support from these peers. But we lasted 1 term at this particular school. The teacher didn't understand how to support Benji. She had a chart on the wall with only Benji's name, citing all his misdemeanours which were reported by the other children. The teacher would tell me every day when I came to pick him up about all the things he had done. Never any positives. This ended up with me not wanting to pick him up because I knew I would be faced with the same negative conversation every day. This made me realise I had to be an advocate for Benji and withdrew him from the school. To be an advocate for Benji, I knew it was crucial that I had a knowledge of legislations and policies that ensured Benji was given equal opportunities and treatment in school. I learned that under the United Nations Convention on the Rights of a Person with a Disability, Article 24 states that children must not be excluded from the general education on the basis of disability. I also learnt about the anti-discrimination legislation, including education standards that will protect Benji. We enrolled Benji into a mainstream school and found the support we needed. The teacher worked alongside the counsellor to create an inclusive environment for Benji. The teacher created visual supports to support his communication. This consisted of symbols, pictures and photographs that simplified messages by breaking down the core components and provided Benji with a link between verbal and visual information. The aim of the visual supports was to not replace oral communication, but rather to support it. This assists with Benji's independence and decreased his frustration when he doesn't understand. She used visual labelling as I communicated with her the effectiveness of labelling any classroom items. This is a part of Benji's routine at home, and I knew Benji would benefit from it being transitioned into the classroom setting. There were visual schedulings of the daily routine, so Benji copied the whole class routine onto his chart to reduce his anxiety and to inform him of the routine and to identify any changes that were happening on that day. She used a communication book, as Benji will have access to the visual symbols for important things such as people, places, or concepts for when he can't express verbally. And there were choice boards. If Benji was having a temper tantrum, he could select from the board what he would like to do to calm down. This would support his good behaviour by giving Benji access to his preferred activities or items. The teacher modelled to the class Makoton Sign Language, which Benji uses at home. To support Benji's social inclusion in school, it was important that all the stakeholders involved cater to his individual needs and development. These opportunities included play-based learning, providing opportunities to practice skills in different environments and to interact daily with one another, peer-to-peer support, building friendship and a buddy initiative, providing toys that encourage cooperative play with peers. Benji will learn together with peers and has the same opportunities to social activities that the school community offers. The learning and support system also only provides support as necessary and fades in and out of experiences. When communicating with Benji, I worked with all the stakeholders to discover the effective methods that have been shown to support his communication skills and social interaction with others. This includes allowing time for Benji to communicate and use his own words. When building a rapport, talk about something easy and topics that interest him. Ask open-ended questions and only deal with one piece of information at one time. Explain and remind Benji of the rules behind social exchanges. Use plain everyday language and check for understanding to make sure Benji has understood the information. And it is important to use relaxed body language. I have contacted Benji's teacher so that she can tell you about how she has used the Universal Design of Learning Guidelines as a tool to optimise teaching. These strategies cater to Benji's intellectual opportunities in the classroom.
Hi, I'm Miss Conway and I'm Benji's pre-primary teacher. Through the incorporation of the Universal Design of Learning, I have effectively supported Benji's learning through instructional goals, assessments, methods and materials, customised and adjusted to meet his individual needs. This meant that Benji's learning is supported whilst being taught the exact same content as his peers. Inclusive education allows Benji to be provided with the same academic and social opportunities as his peers. The same curriculum for Benji as the other children in my classroom has resulted in numerous academic benefits. Benji has significantly higher scores in his vocabulary and grammar comprehension and benefits from having one-to-one support for his mathematics and reading. I use constant repetition and explicit instructions to give Benji the opportunities to understand the content and consolidate his knowledge. More specifically, I use one-to-one and small group instructions which encourages Benji to interact with his peers and ensures that Benji engages in the experiences. Any worksheets given to Benji has large font with easy-to-read, short sentences and non-abstract concepts. His learning support assistant also helps with other children so it doesn't seem like she is just there for him. She also does regular assessments to check his understanding and communicates results with Heather, Sam and I. At the end of each day, I will communicate with either Heather or Sam an overview of Benji's day. It is important to pass on this information to develop an effective home-to-school communication system. We also have a communication book to inform each other of any necessary updates. I encourage his parents to be involved in school activities and give them optional activities for at home, so they can reinforce what Benji is learning at school. We have meetings once a fortnight to discuss any challenges or changes that can be made. I also keep in regular contact with the school counsellor, Benji's occupational therapist and speech therapist to update strategies and resources to continually support Benji.
As Miss Conway said, communication amongst all stakeholders is crucial to be able to effectively support all of Benji's domains of development. Key stakeholders that support Benji include his physiotherapist, speech therapist, occupational therapist, his learning support assistant, counsellor and school staff. Benji's physiotherapist focuses on the development of complex motor skills and strength-based activities to build muscle tone. I practice these new skills at home and communicate with Miss Conway to incorporate them into his daily routine at school. Benji's occupational therapist also supports Benji to master skills for independence through self-care, fine and gross motor skills, or completing classroom routines. His occupational therapist has also provided adjustments to his classroom chair, as Benji requires minimal levels of postural support when seated. We have monthly visits to his speech therapist to review targets and activities set for Sam and I, Miss Conway, and his learning support assistant. These activities are to be included into Benji's daily routine. His speech therapist also assists Miss Conway in using reading to teach language and to incorporate his current goals into his one-to-one reading activities. His learning support assistant also writes in the communication book and is involved in the fortnightly meetings. The school staff are also aware of Benji and are kept up to date with necessary information to ensure that they can support him around the school. I will continue to be an advocate for Benji for the rest of my life. I want to educate people that children with Down syndrome have the same potential as you and I and should be provided with equal opportunities. I hope you enjoyed following my journey.